A very warm welcome to my channel, Doc Nature Lover. Welcome to my channel. As you guys all know from the video thumbnail that this is an coronavirus testing update. At the end of the video, you'll be able to know what exactly went wrong with the time frame of the testing and what are we going to do going forward to have grip over this horrific pandemic, COVID-19. I'm Doc Nature Lover. And first of all, I do want to mention something that YouTube has decided not to monetize any of the videos which are done for COVID-19. I really love that decision, so that will prevent people who know little about the disease to go live or have video presentations just for monetization reason. So these videos are not going to be monetized. This is just a disclaimer. Most of these views and discussions have been done by me as a physician from CDC, WHO, CNN, and other sources. If any of these things are not exactly accurate, they are sometimes could be from the information that I gathered, but I can tell you to the best of my knowledge, I'm trying to give you as much update as I can. So starting first, my own experience, because this is very, very important for you guys to know, because I work at the grassroots level. So people call me and people come to me with the symptoms. So I had cases where the patients had traveled to Italy, and there were cases who were exposed to people who came back from Italy. I reached out to the public health line, the government public health line for Florida. After I placed the call, I did not get a call back from them until 6.5 later. So I called around 12 noon and I got the call back from them around 6:30 p.m. That was about 6.5 hours approximately. They were very nice and clarified my answers. However, they said that my patients, even if they have traveled to Italy and they have fever, they do not need testing for COVID-19. And they will just be treated the natural way, not because they have not been in contact with anybody with COVID-19 does not make them a criteria for testing. The same thing if people are immunocompromised. When I reached out to the health department, the answer was same. Because the patient did not come with the COVID-19 virus, even if they have sore throat, flu, chills, high temperature, we cannot be doing the testing because they did not come in contact. Even if they were household people, they were not positive for COVID-19 or they were not admitted or seen in the ER. These were the three criteria that was told to me. Going forward, I want to clarify a few things on this. So what actually went wrong? Why was this huge delay? To know about the time frame, I'm going to give you an idea what exactly happened. So the whole delay was there starting from February. However, last week, our respected Vice President had declared that 1.5 million testing kits are going to be going out for testing. However, out of that, through Atlantic investigation, this is the number of tests that has been conducted in the United States at this point, which is 13,953 tests. This was accurate up till 7 a.m. today, Central Time, and the timeline here it starts. So this is, we are talking about February 1st week. This is very important to know the time frame. This is February 1st week. So basically what happened was they did not get the test or did not get the supplies that were needed. When I asked the health department that if I could get the kit myself so that I can send it off to CDC, they said that since you did not meet the criteria, we are not being able to do any testing that can be sent to the physicians at this point. Although we were seeing quite a few patients with fever and chills and some sort of traveling experience. So the other point was, in order for me to see a patient, I needed a few things, because when you're doing the testing, you're coming in close contact to the patient. you are right like here. So you're going to do a nasal swab or a throat swab. So you'll be coming very close. So in that case, we needed special equipments, including goggles. We needed a yellow gown. We also needed special gloves and an N95 mask. These things were available, and I was able to get hold of these things. We had the supply of that. So we had the means of testing in the office while this was going on. So the next thing that I'm going to talk about, the causes, what went wrong, why was the testing delayed? So this is what happens is when you have a pandemic, emergency EAU, which is clearing of other private companies, goes in. This is on emergency use of the clearance. So this is called emergency use clearance. So this EAU, this during an outbreak which is released was not going through. So Dr. Greninger, Assistant Director of Virology, University of Washington, which was at the heart of this disease, had reached out to them, but that the tests, and we do not have the supplies that are needed for the testing to be done. Once this was reached out, they could not still get the kits. So this is February 28th. A petition or letter was sent from Dr. Greninger telling that during Ebola and Zika virus spread, we had received the EAU within a day. However, after that, they had told that they wouldn't be able to get the EAU until 2 weeks from 28th of February. Here comes the Biomérieux. This is a specialized company. What they do, this is based in France. So what they do is they do diagnostic testing. Mark Miller from there, the Chief Medical Operating Officer, had reached out and got the same kind of information that on 14 days will be needed to get the EAU. Usually in these kind of cases, the EAU received is just in 1 or 2 days max. So the lab has developed this test, and special instruments are needed to do the testing or extraction and sampling of the DNA. The labs did not receive any kits on time because the reagent that was needed for the virus that was developed by CDC was actually a defective sample. So they could not start doing any labs. The only place we were doing the testing was directly through CDC. Then we also had some problems going forward with coordination and leadership. So basically CDC was not able to get in touch with a lot of people, and there were some exact loopholes, we don't know exactly, but definitely there were some loopholes through which the leadership kind of failed, and we did not start the testing even then because we didn't have supplies. This is a breakdown of the date and the number of tests done. So this column is date, the sample was received. This is how many tests performed at CDC, and this is how many tests performed at US public lab. So on 118, 4 cases were tested by CDC. Now these are on the website, so I'm not making up any of the numbers. These are actual numbers from CDC and other authentic sources. 0 lab was done because they didn't have the supplies or means of testing. Although the lab was already had developed a way of testing, they didn't get the supplies or the kit for testing. 119, there was no test conducted by CDC, neither was no test conducted by the US public because they didn't have the supply. 127 patients were checked for sampling. On 121, 3. On 123, 36 cases was the double-digit number, started around 123. And then on 26, the first testing for the US public lab, this was the first test. This was done on 6th of February. And on that day, they had 74 cases done at CDC. 214. So this was almost a month back. We had 36 cases that was done by CDC. 4 cases were done by public lab. On 217, the public lab did 26. On 227, we had 62 cases. 117 was done by public lab. On 32, we had a huge amount of public lab cases. So 489 cases were done at that point. This is March 2nd. This is the beginning of March that CDC did 94 and 489 was done in the labs. And on 3/9, we had total of 28 done by CDC, but the amount of cases that was done by the US public lab was 2094. And then talking today, we had 312. We did not have any done by CDC on that day, and there were 6 cases done by our public lab. All right, so going forward, we know that things have not gone the way it should be. So going forward, we do not need to strike on the panic button right now. What we need to do is more and more testing. Testing. That is all is needed at this point, so we can identify the people quickly. Otherwise, it's going to be rising on an exponential level. On March 13th, Roche, a Swiss company, developed a test called PCR, and up to date, I will put it in my column below how many cases that has been diagnosed as of today right now, because I did not want to give you a figure which was done in the morning. I didn't want to give the figure. So I'm going to put that figure down on the link below. You just click on the link. Now, what did actually Roche do? So Roche, what they did was, in order to detect the test, they did what we call as reverse PCR. So what happens during a reverse PCR? This is, they are going to get the virus sample. After they get the virus sample or the viral RNA, they are going to change that to a viral DNA. And then this DNA is to be replicated in the lab and see which patients have the virus. And as of now, they are saying that this test is very, very sensitive and specific. I cannot say exactly how sensitive or specific. I will be doing an update almost every 48 hours or the best of my ability and the best of my knowledge. And this test is very, very sensitive. So if the test is positive, the chance of you having false positive is very, very low. So it's a very, very specific test that was developed by Roche. Yesterday, you guys might have watched that our president had addressed to the nation and had told that they were coming together and opening drive-through places inside Walmart, inside other places, supermarkets like Target and LabCorp, Quest. Everybody is coming together as a team and forgetting all the differences between each other on one common ground, how we can stop this pandemic. I feel this is my moral right and also my moral decision to notify my subscribers and viewers. If you continue liking this kind of content on coronavirus updates, please do not forget to subscribe. And if you like the video, please do not forget to give a live thumbs up and hit on the bell icon for notification. So right now, as of March 10th, we have 700,000 tests available through Roche. We are anticipating this was distributed to the lab already. We have 2.1 million kits ready to be dispensed and sent to the lab in next week. So that is the amount of cases we have. How are you going to get the testing done? So the testing also on my Facebook page, you will see that I have given the link for the testing. In case if you haven't seen it, this is the website you go, http. So find our health center, hrsa.gov. I'm going to list down below. And when you go to the website directly, you put your zip code and find out the nearest health center where the testing can be done. These tests are free of charge. These are not going to cost any money. If they are going through this website and finding out the nearest center they can go. I searched 2 places on there. One was Winter Garden, another was Claremont. At Claremont Center, this phone number or community health center number was given to me within a 30-mile radius. I searched. Again, I searched for another place in Orlando called Winter Garden, which is extended part of Orlando. And this said that this is a community health center where we have, this is the phone number for them. That's for Winter Garden people to go. Again, this was a zip code 34787 that was done. So here I want to end the live update. Please do not forget to subscribe, because I will be doing an update almost every 48 hours, and I will be also answering questions. If you have any questions, please link down below the questions so I can answer on my next live video, which will be done tomorrow at the same time at 8 a.m. Florida like EST time, and which is 5:30 p.m. Indian Standard Time. Please share this video so that more and more people can know about this testing. Thank you very much. Have a blessed day.